আমরা আমাদের আজকের অনুষ্ঠান শুরু করতে যাচ্ছি। আমি সবার দৃষ্টি আকর্ষণ করে বলছি, অনুগ্রহ করে আপনারা আসন গ্রহণ করুন। সম্মানিত অতিথিবৃন্দের দৃষ্টি আকর্ষণ করে বলছি, অনুগ্রহ করে আপনারা আসন গ্রহণ করুন। বঞ্চিত, যার ফলশ্রুতিতে এটি ছিল একটি পরিকল্পিত উদ্যোগ। বড় হওয়ায় প্রত্যাশিত সময়ে সম্পন্ন করা না গেলেও এই প্রকল্প এখন শেষ হওয়ার পথে। এই প্রতিষ্ঠানকে উন্নত সেবা প্রদানের লক্ষ্যে আগামী 5 বছরের জন্য অস্ট্রিয়ার একটি আন্তর্জাতিক হেলথ কেয়ার ম্যানেজমেন্ট গ্রুপ VAMED-এর সাথে হাসপাতালের সার্বিক পরিচালনা চুক্তি সম্পন্ন করার জন্য আজ অনারম্ভ অনুষ্ঠানের আয়োজন। ডাক্তার রবিউল হোসেন, মঞ্চে আছেন ইম্পেরিয়াল হসপিটাল লিমিটেডের ম্যানেজিং ডিরেক্টর জনাব আমজাদুল ফেরদৌস চৌধুরী। আরও উপবিষ্ট আছেন চট্টগ্রাম চক্ষু হাসপাতালের ট্রাস্ট বোর্ড চেয়ারম্যান এবং ইম্পেরিয়াল হসপিটাল লিমিটেডের ডিরেক্টর জনাব MA মালিক। VAMED-এর পক্ষ থেকে আছেন মিস্টার ক্রিস্টফ উইগল, ম্যানেজিং ডিরেক্টর VAMED। আছেন ইঞ্জিনিয়ার স্ট্রমিয়ার, প্রজেক্ট ডিরেক্টর ইম্পেরিয়াল হসপিটাল লিমিটেড। আরও আছেন মিসেস ক্রিস্টা স্ট্রমিয়ার, যিনি ইন্টারনাল ডিজাইনে সাহায্য করছেন। আজকের অনুষ্ঠানের সভাপতিত্ব করবেন জনাব MA মালিক।
I have great pleasure to welcome you at this small but a significant function. We have amongst us today representatives of VAMED Healthcare Management Group who have traveled a great distance to join us here today, and we are very delighted to welcome them. We have amongst us representatives of various areas who have responded to our call and always been supportive to our activities. We are very happy to welcome our guests, friends and well-wishers who, in spite of their busy schedule, have joined today, and their presence is a source of inspiration to all of us. Many of you are aware that for the last few years we have been struggling to complete this big healthcare project, which is now nearing completion. Today we are embarking on an important milestone, that is, IHL is going to sign an operational and management service agreement with VAMED and European Healthcare Management Group, initially for a period of 5 years. The main features of this agreement is that they shall engage senior management team such as CEO, Director of Nursing, Director of Medical Service, who shall develop rules and procedures and systems to run the hospital in an effective way. They shall also assist IHL in the selection, training, orientation, and utilize the services of this manpower in an effective way. VAMED shall also assist us in the technology transfer through regional and international collaboration with other healthcare institutions. For your kind information, VAMED has been assisting us for the last 2.5 years in a number of significant and critical areas. Through the engagement of its project director, engineer Separate Kumar, who is here today, is looking after all the technical aspects, HVAC, power, fire, medical gas, VMS, and all sort of critical areas. You will hear from him what he has been doing for the last 2.5 years. This group has also engaged a biomedical consultant to develop specifications of the equipment instrument needed, their evaluation, and help in the installation of equipment. Thirdly, VAMED also engaged a consultant on the development of information technology. Now you know this is the age of information technology. And starting from the selection of IT cables up to development of software, selection of contractor and hardware and everything they are going to develop. One important thing I should say, to my knowledge, this is the only hospital at the moment in the country in the IT system which is called a PAC system. This system is automatic generation of all information, all the imaging, X-ray, CT, MRI, whatever you say, lab, and transmitted to all the consultants, all the doctors in the hospital. Most important that through this technology, Imperial Hospital can consult about a patient in other institutions globally. So this technology is a very important technology for the sharing of information, for the diagnosis of patient, for the treatment of patient. So we are very happy that we have the latest technology at hand. The architectural design of this hospital complex has been developed by a very well-known healthcare architectural group, the KMD, San Francisco based. It took a long time, cost a lot of money, and I want to tell you some of the important aspects of this planning of the hospital, architectural planning of the hospital. It is not only a building to treat and keep the patient, but a lot of considerations have been taken care of when developing this architectural design. Some of the points I'd like to inform you, they have taken consideration of environmental issues. They didn't want to disturb the green, the environment, what does exist. So they took care of the environment. Even when I requested them to make a high-rise building, I remember, they said no. Asked why. They said they didn't want to spoil the environment. A tall structure here would have spoiled the whole environment, particularly the eye hospital. They said, we are not going to make a tall building here because safety of the patient is very important. Suppose there is a fire. In our country, the disaster management is very inadequate, very poor. How do you get a patient down from 10th story? If there is a fire, if there is an earthquake, if there is a cyclone, and Chittagong is an earthquake zone, a cyclonic zone, so they didn't allow more than 5 stories. Instead, they went down one floor down in the bottom. So this is very important, I've learned. They thought about the present need. They also thought about the future need. So the planning was 20 years, keeping in mind 20 years ahead. Now we know some of the healthcare problems are growing. Cancer is a situation, is a growing. Kidney problems are growing because of change in lifestyle. So it's bound to grow. So what do you do? The architect has kept space in the eastern part for the future expansion of these two disciplines. They also took care of infection control. If the infection control is not taken care of in the design, it is not possible to control the infection. So these are some of the important things they have taken care of. Now transportation of patients. Now the traffic is growing. They have set up a provision for the helipad. Because some of the patients from distance have to be transported here. The only way, quick way, is to have helicopter service. So they have made a provision for it. So these are the few things they have taken into consideration in the architecture, design and planning. Now the main objective of the hospital. Why did you set up a hospital in Chittagong at all? There are so many hospitals, healthcare systems. Now, we want to set up a facility under one roof in one campus, all the facilities. And we have planned that the healthcare, what are the existing healthcare facilities we do have in Chittagong and around Chittagong. We have tried to take care of the existing facilities which are inadequate. So needs to be improved. Some of the facilities does not exist at all. We have tried to take care of that. So these are the two things we have taken consideration. Third thing, the total healthcare delivery does not depend on a structure, does not depend on the doctors and the consultants. Healthcare depends supportive staffs, the trained, motivated nurses, the technicians, trained technicians who will be handling equipment, expensive equipment and all this. This, we have taken into consideration these factors. Instead of this hospital, we have set up a bed provision for the training institute of nurses, training institute for the allied healthcare personnel, technicians, and their accommodation also. So these are the few things we have taken into consideration. The other important thing that we have started, the eye hospital started 40 years back treating the poor patient. We have not ignored that portion here. This is a company, a lot of money have to be taken loan of. We have kept provision to take 10% of poor patient, indigent patient. So we have not deviated from our original motto of serving the poor. Now, to get a gathering like you, particularly our journalist friends, this is an opportunity for me to give you some idea what you are doing, what you plan to do. It's very important for you to know and for us also let you know. And I believe this is an opportunity. Now, the hospital is housed in a almost 7 acres of land, total complex. And we have a provision initially at the moment 350 bed capacity, of which we are going to start initially with 200 beds, gradually expand to 350. Because to run 350 beds, we don't have to supporting manpower. It covers a built-up area of 600,000 square feet. We have made two types of accommodation facilities. One is single room, single cabin you can say, because attitude of our patient is not to share with too many. And there is another provision only for twin, shared by two, not 4 or 8 or something. So we have single occupancy room 88, double occupancy room 76, we have operational theatre 14. Another important aspect, what you notice in this country, not only in Chittagong, but also in Dhaka also, the number of critical care patients is increasing. And to handle critical care patients is the most difficult part. Not everybody can be flown to Singapore or Bangkok or India. So that's why we have kept a provision of 75 beds, critical care beds, including 10 beds for the children, neonatal. So I know we have made a provision, physical provision. Now the headache, but to get these trained nurses and technicians. This is the most difficult part in this country. Anyhow, we made physical facilities arrangement. We have all the other facilities. Now, in the operation department, we have 52 rooms for the consultation. Means 52 doctors at one time can see patients. And we have arrangement for 23 clinics, such as pediatric clinics, cardiac clinics, and all sorts of specialized clinics, endocrine also. Another important thing we have watched over the years, patients coming from this sort of facilities, the patient travel from far distance. When they travel here, accommodation is a very difficult thing. And we have made a provision for accommodation of patients. 14 number rooms for the patients and the attendants coming from abroad. As a patient, when I travel to Bangkok and others, I find that it is very advantageous to stay in the campus, or you can have all the blood tests done without traveling. And so we have taken care of 40 rooms accommodation in the campus for the patient and the attendants. mentioned earlier, there is a Nurses Training Institute, there is a Allied Health. Nurses Institute intake will be 50, and for the Allied Health, initially intake will be 25. And that is, we have a separate block. That block, we call it multi-purpose building. That's in the entrance. This is a building with a plan. In the basement there is a car park. In the first floor there is a central cafeteria, canteen for the staffs and the patient attendants. Provision for the bank, provision for the gift shops, all several supporting service, whatever is needed for hospital. Another 2 floors is the Nurses Training Institute. And on the top we have this accommodation for the patients, etc. It's a very composite and complex, structure and situation planning. We have also made accommodation for the trainee students, 271 dormitory for the male and female. Now, we are trying to set up through our partner VAMED international collaboration. We can only grow, technology transfer, exchange of ideas and information can only happen between tuning of the institutions. The world is getting smaller and we must share technology and all this. VAMED is going to help us in this regard. Before I end up, I want to remember 2 questions. One is late Mr. Akhtaruজ্জামান Chaudhary. Now Imperial has come forward to help us in a syndicated role. And with them join the world. This is the only healthcare institution in the private sector World Bank has come forward. When I met them in their office, I remember they told that we have selected this institution to provide support from the world. I asked them why. They told that there is no good healthcare facilities in Chittagong region. 2, this is a project, it is not purely commercial. The project is sponsored by a trust, the Eye Hospital Trust. Third thing, they told, in this country, the human resource development, particularly the nursing training institute, nurses and technologists, it is in our plan. And this is very important for the country. And fourthly, they said, you have taken provision to treat the poor patient. So these all happened one after another. Late Akhtaruজ্জামান Chaudhary, in my room, Eye Hospital, Mr. Malek, we discussed about setting up a hospital in Chittagong, which is very much needed. I told them, you have money, you can go to England, America and all this. How many can go? Think about the others. It motivated him. He put up in the first board meeting about the support from his superior. He placed it, so he is no more here, but I thought that he started saw the seed, and Imperial has come forward on the syndicated law. World Bank has joined Imperial and also another person who was really sincere. Not late, is the recently retired, the MD of Imperial, Mr. Al-Mahmud. He is from Chittagong. He really pushed things very hard. He only retired last month or this month. Anyhow, I thought that these are the two great souls who has contributed significantly towards setting up this hospital. So I thank all for this.
ধন্যবাদ প্রফেসর রুবেল হোসেন। সম্মানিত সুধী, এখন ইম্পিরিয়াল হসপিটাল লিমিটেডের ম্যানেজিং ডিরেক্টর জনাব আমজাদুল ফেরদৌস চৌধুরী এবং VAMED-এর ম্যানেজিং ডিরেক্টর ক্রিস্টফ উইগেল নিজ নিজ প্রতিষ্ঠানের পক্ষ থেকে সাইনিং সেরেমনি সম্পন্ন করবেন।
Good morning, dear Chairman, members of the board, valued guests. I'm very pleased that so many of you followed the invitation from Imperial Hospital to join us today. For Imperial Hospital, certainly for VAMED, today is a big event, as we want to share with you the exciting news that this hospital is going to open very soon, and it's going to receive its first patients very soon as well. So what this means to Chittagong is that Chittagong will finally have a hospital matching the best hospitals in Dhaka, meeting international building but also management standards. Today, if citizens in Chittagong have serious health issues, they need to go to Dhaka, or they have to fly out to Thailand, India or Singapore. This will surely change when Imperial Hospital is up. Everybody who knows the chairman knows that throughout his entire career, his dream and ambition was to improve the healthcare system in Bangladesh, in particular for the underprivileged people. The Chittagong Eye Infirmary and Training Campus just next to the Imperial Hospital, as well as many eye hospitals across the country, are living proof of his achievements and his passion for healthcare. So what Imperial Hospital will really set apart from other private hospitals in Bangladesh is not only the clinical and the service quality and the technology which will be put into the hospital, as the chairman mentioned, but it's also the contribution to the healthcare system in Bangladesh as a whole. The professor mentioned that this hospital will provide 75 intensive care unit rooms. This is something Chittagong is in desperate need of. If you are in a critical condition nowadays, you have to fly out to Dhaka or elsewhere. Soon this hospital will be able to provide this critical service to its citizens. What also is different is the social mission, the strong social mission of Imperial Hospital. As the professor mentioned, there is space being provided to actually serve the underprivileged for free. So VAMED is very proud to be a partner of this project and be a partner of Imperial Hospital. And together with the shareholders of the Imperial Hospital, we want to ensure that the hospital will live up to its expectations. As the professor mentioned, our role over the past 2.5 years has been to assist Imperial Hospital in commissioning the hospital, to assist them to a stage where we are today. In future, our role will be, together with the shareholders and everybody in the Imperial Hospital, to manage the hospital according to international standards. Everybody knows the professor, the chairman, and the board members. I'm sure you don't know much about VAMED, so I would just like to say a few words who we are and what we do. We have put up a slide here which very nicely summarizes our background. VAMED was set up about 35 years ago in the capital city of Austria, Vienna. And at that time we were tasked with commissioning the university hospital in Vienna. Austria is a very tiny country with a population of only 8 million people. So in order for VAMED to grow, we had to look outside. We had to go international. And as we stand today, we have done about 800 healthcare projects in about 80 countries in 4 continents in the world. What is unique about VAMED is that all those 800 projects are exclusively in healthcare. So we are truly a healthcare player. And that, I think, sets us apart from many other companies. The other thing I want to mention, because I think it's of relevance here, is that VAMED has experience and competency to act in challenging environments. So we have been successful of building and managing healthcare institutions in challenging environments. So for example, currently we're building hospitals in Papua New Guinea, here in the middle of the rainforest, up in the highlands. Or we're also building a 300-bed hospital, similar size as here in Laos. So what I'm saying is, we think we know what it takes to bring Imperial Hospital forward and to be successful. A few more facts. Currently we have about 17,000 employees worldwide in 60 over locations in 4 continents. So this should just give you a picture of the size of VAMED. Usually our clients are hospitals, are clinics, are wellness centers, are rehabilitation centers, are research centers. So all the clients are in the broader spectrum of healthcare. Just to give you a feel for our portfolio, what do we do as VAMED? We are pretty much involved in every step of the development and management of a hospital or healthcare facility. So we provide planning services to plan a hospital or a facility. We are involved during the construction time, which means project management, which means engineering services, and commissioning services, pretty much what we have been doing over the past few years in Imperial Hospital. And once the hospital is complete, we need to manage it, and this is also part of our role. In fact, VAMED owns and manages about 40 healthcare facilities by our own. So most of our hospitals and healthcare institutions we own are in Austria, Switzerland, Czech Republic, the UK, one coming up now in China and in the United Emirates. And that's really all I want to say about who is VAMED. That should just give you a glimpse and a feel of who we are. So we think that this expertise we have gained over the past 30 years puts us into a very good position to ensure, together with the professor and the shareholders of the hospital, to make this a successful project, make Imperial Hospital succeed. And I want to conclude with expressing my firm belief that we will make Imperial Hospital the best hospital in the country, serving thousands of patients in and around Chittagong who desperately need better health care. With that, I would like to conclude my short speech, and I would like to thank you again for joining us today for this important event. Thank you.
থ্যাংক ইউ মিস্টার ক্রিস্টোফার। এখন অনুভূতি প্রকাশ করার জন্য বিনীত আহ্বান জানাচ্ছি ইম্পেরিয়াল হসপিটাল লিমিটেডের ম্যানেজিং ডিরেক্টর জনাব আমজাদুল ফেরদৌস চৌধুরীকে।
আমাদের আমন্ত্রণে সারা দিয়ে আপনারা আজ উপস্থিত হয়েছেন। চট্টগ্রাম বাংলাদেশের শুধু দ্বিতীয় বৃহত্তম নগরী নয়, দেশের প্রধান বাণিজ্য নগরী। কিন্তু দুঃখের বিষয়, চট্টগ্রাম উন্নতির দিক থেকে সব ক্ষেত্রে পিছনে পড়ে আছে। যেমন আগামী ব্যবস্থা, শিক্ষা, বিশেষ করে স্বাস্থ্যসেবা তাতে অনেক বেশি পিছিয়ে। জটিল রোগ শুধু নয়, সাধারণ রুটিন চিকিৎসার জন্য অনেককে চট্টগ্রামের বাইরে পাঠিয়ে দিতে হয়, যা অনেকের জন্য সময় সাপেক্ষ, কষ্টকর ও ব্যয়বহুল। এই সত্যটিকে উপলব্ধি করে স্বনামধন্য চট্টগ্রাম সভ্য হাসপাতাল ট্রাস্ট বোর্ড এগিয়ে এসেছে একটি উন্নত মানের পরিপূর্ণ হাসপাতাল প্রতিষ্ঠার জন্য। এতে আমরা চট্টগ্রামের প্রতি কয়েক সমাজসেবক এবং উদ্যোক্তা এর মধ্যে যুক্ত হয়েছে। হাসপাতাল প্রজেক্টের গুরুত্ব অনুধাবন করে সহায়তা এগিয়ে এসেছে UCBL ব্যাংক লিমিটেড, সিন্ডিকেটেড লিডারশিপ এবং আরও কয়েক ফিনান্সিয়াল ইনস্টিটিউশন, বিশেষ করে ওয়ার্ল্ড ব্যাংক। ইম্পেরিয়াল হাসপাতালের সংখ্যা এবং প্রধান উদ্যোক্তা চেয়ারম্যান ডক্টর রবিউল হোসেন সাহেবের প্রজেক্ট সম্পর্কে মোটামুটি ধারণা আপনাদের মধ্যে পেয়ে গেছে। ভবিষ্যতে আপনাদের আরও সহযোগিতা এবং উৎসাহ কামনা করে আমি এখানে শেষ করছি। আমাদের সবাইকে আপনাদের সবাইকে আমার ধন্যবাদ, বিশেষ করে VAMED প্রতিনিধি দিয়ে আমাদের আন্তরিক অভিবাদন জানাচ্ছি। আসসালামু আলাইকুম।
ধন্যবাদ জনাব আমজাদুল ফেরদৌস চৌধুরী। I requested now the engineer Stormier, who is providing support to this project for last 2.5 years.
So, thank you, dear ladies and gentlemen. I want to introduce, following the speech of Professor Rubio Hussein, what was developed and what was the idea to follow in establishing a quality hospital in Bangladesh, in Chittagong. Our idea we got in 2.5 years ago. We started here, we did some examination, we visited the hospital, the existing one, and from now on we implemented a lot of ideas and recommendations how to improve. We want to bring the hospital to top level. We are doing the organization and management to bring it in the highest level. Basics are, for example, when you start with a hospital, you do analysis. What is required? Where do you need energy? What is the way of patients? What is the way of materials? Way of staff? All this requires detailed analysis. We call it like workflow analysis. Without that, planning of a hospital is not really successful. So all these ideas we brought additional in. We had to adapt a lot in this hospital to have all the rooms available. We also implemented now in the design very special things, like in OT you have so many regulations to follow, and also normal ideas. We have to protect the patient in the OT. So in the OT you have to have special air treatment. The air handling unit must be able to provide air at a higher pressure. When the pressure is high in the OT, air is not going in, because air going into this OT, which is not filtered, could bring in bacteria, virus, fungus, all this. So we implemented in the design all OTs with a positive pressure system. But this is not enough. Positive pressure system gives you now safety against some bacteria. Also, flooring, all these ideas must be followed. Even the surgeon is doing the operation on the patient, it is not allowed to have any static electricity. If you imagine you have the open body, and then what will happen if there will be the tiniest spark of electricity, and it will disrupt your complete biological control system, and maybe the patient will die. So therefore, not only anti-static, it is a kind of conductive flooring. All this must be carefully examined and checked. So this is in our program. Many other things. When you do flooring, you have to do complete rounded corners to avoid all the infections which are remaining after cleaning. Cleaning must be easy possible. So not only way analysis, also analysis of how to implement the technical systems. So basically, good air conditioning, avoiding gaps in flooring and in walls to prevent cross-infections, to avoid the well-known problem of hospital bacteria which are growing in such places, and you can hardly fight with antibiotics because they are already resistant against this. So our system is, we go to the source and we prevent this cross-infection. All this must be implemented very careful. We do also in the electrical system, in OT, we have UPS system, we have isolated systems. Isolated system means even if there is an electrical failure in an OT, this electrical failure is compensated by some isolation transformer, and surgery can go on. There is no fault, no finishing of electricity, no tripping of electricity for the first failure. This is compensated. The UPS provides uninterruptible power. What the name tells you, UPS, uninterruptible power supply, you have continuous electricity. It's also easy to imagine surgeon is working inside the body, and think about electricity is cut off. Then surgeon is sitting in the dark, he's seeing nothing, what to do with the patient. So this is a very risky, dangerous situation. And by implementing such systems like UPS is one step. Another one is emergency diesel generator, which will supply after 15 seconds all the other relevant and necessary equipment. So we are doing all to design the safety for the patient and also the safety from work and to reduce risk for patient, reduce the risk for also the staff. That means we have also isolation rooms. If there is any infection, then you have to put the patient into a room with negative air pressure. We have to take care that no bacteria can go out of this room. In the other way, you have an isolation room where you protect the patient, where you have positive pressure. If you have, imagine you have somebody burned, so skin is removed by the fire, so he must be treated in the burnt bed, and then you have to provide positive air pressure from the technical, additional to all the medical necessary steps. So the hospital is, we can say, under such design. We have also the different entrances. You have seen here the main entrance. On the other side there is emergency entrance. So we have also done the workflow analysis, how to get, how the patients come into the building. Then from emergency, there you have a good connection to radiology. Radiology is highly developed and can really, not only radiology, all the imaging and the hospital can really compete with actual European standard. This is also because it is now new. So this new hospital has given the chance to buy latest equipment, to bring in the latest experience in developing hospitals. So our result now will be a high, we can say highest level hospital in perfect diagnostics, perfect MRI, this means magnet resonance imaging, CT for cardiology, with very fast acting, so even during the heart is beating, the radiology picture can be taken. That is one of the fastest machines you can get. It's not available here in Bangladesh, only with us. And so there are so many points I could explain, but this is too much technical speech. I don't want to make you tired about too much technical. The message is this hospital will be able to provide good treatment, the technical support is given. You will have later on also helicopter pad, will be very useful. The roads outside are not that nice, even if you have a transport, for example, from the airport in Chittagong to this place, and the patient has some injury or after some operation, he feels a lot of pain when the car, the ambulance is shaking. So this will support, or even in cooperation with another hospital, for example in Dhaka, you can transport also then by helicopter patients from Dhaka to Chittagong or in the other direction, which will have the possibility of a very fast connection without bumps. It is so important, for example, people with spine problems to be transported without bumps. Not only pain, it will disturb the spine. So this is only just some basic information, and We are continuing this year with the hospital. We have the program to commission it, to put it into operation, to make it ready for the management with some overlapping period. That's our job. I hope you got some good information from my side. I thank you for listening.
থ্যাংক ইউ মিস্টার স্ট্রোমিয়ার। সুধীবৃন্দ, আমন্ত্রিত অতিথির মধ্য থেকে কেউ তাদের অনুভূতি ব্যক্ত করতে চাইলে তা প্রকাশের জন্য আহ্বান জানাচ্ছি। আমন্ত্রিত অতিথিবৃন্দের মধ্য থেকে
রহিদুল আলম, আসলে এরকম একটা হসপিটাল আমাদের 50 বছর আগের থেকে 20 বছর আগের থেকে আমাদের দেশে প্রয়োজন ছিল। আমরা যখন আপনারাও যখন চিকিৎসার জন্য বিদেশে যান তখন আমরা অকওয়ার্ড সিচুয়েশনে পড়ি। আমাদের এখানে 10 বছর আগে ভালো এন্ডোস্কোপি হতো না, 15 বছর আগে ভালো সোনোগ্রাফি হতো না। ইউরোপের যে টেকনোলজিগুলো আজকে ওনারা ট্রান্সফারের কথা বলতেছেন, এগুলো আসলে আমাদের সবার জন্য গর্ব এবং আমার সবাই আনন্দিত। আপনারা সবাই এখানে যে অবস্থানে আছেন, আমার মনে হয় আমরা এই হসপিটালের অথরিটিকে আমরা সাহায্য করে যাব অ্যান্ড উই এক্সপেক্ট এ গুড কমিশনিং ইন শর্টেস্ট পিরিয়ড অফ টাইম। থ্যাংক ইউ ভেরি মাচ।
The dream is on the verge of coming true. I congratulate Dr. Rabil Hussain, the main organizer, and his team. VAMED. In short, we'll be seeing that modern technology is being utilized here, and we don't have to go anywhere abroad or even to Dhaka for treatment. I congratulate all those who have taken enormous trouble to come to this stage. In future, we have a bright future, and let's all hope and pray that this dream comes true. Thank you.
ধন্যবাদ ডক্টর করিম আলম সিরাজউদ্দিন স্যারকে। ইম্পেরিয়াল হসপিটাল লিমিটেডের পক্ষ থেকে জনাব এম এ মালিক স্যারকে ধন্যবাদ জ্ঞাপন করার জন্য
It's a proud moment, a proud day, a very happy day, not only for Chittagong but for the whole of Bangladesh. And for this, we all of us are grateful to one man, Professor Rabil Hussain. If you think you have not seen a genius and you want to see one, that's him, Professor Rabil Hussain. I would especially like to thank our foreign guests. In fact, they are no longer foreign guests. They are also Chittagongians. That's how we will always treat them. And we are grateful to you too for extending your assistance, cooperation to Professor Hussain. With these few words, I would request all of you present here and also those who are not present here to come forward and help Rabil Hussain to turn it into one of the greatest medical institutions in Asia. Thank you so much.
Assalamu alaikum. This is Professor Iftikhar Chaudhary, Vice Chancellor at University of Chittagong, and also the Honorary Director of Imperial Hospital. At the same time, the trust member of High Infirmary Training Complex, Joint Secretary of PNSB, at the same time, Chairperson of the Community of Ophthalmology and Natural University Institute. Like this institution, it's my immense pleasure, proud privilege to be here to listen to all those options, facilities, everything from the foreign guests. And another chairperson, Dr. Rabil Hussain, is not only a person, he's not only a doctor, he's a pride and the great soul of this nation. And we are all with him to promote this kind of services to the community. Especially, you know, every year, 2015 and 16, from this country, 2,224,000 কোটি টাকা শুধু চিকিৎসাতে গেছে ভারত, 24,000 crore টাকা. So it's a huge amount of money. You understand that every year we have been, transferring to India or other nations for having this kind of treatment. So definitely it will help us to provide services from this hospital and not only save the foreign currency, rather to improve the quality and enhance the quality of the whole medical services from this institution throughout not this country only but throughout the whole globe. So taking this opportunity, I'd like to offer our heartiest thanks again to Professor Dr. Wilson and the foreign teams and our managing director, a great personality and giant industrialist, Mr. Al-Mahmud and our great leader, our guardian, Mr. Malik, who are all the time having a lot of time, spending huge amount of time behind this hospital, though I give very less time because of my preoccupation of others, but still there we are going to see a practical, as a pragmatic approach we are having to go for dental services. So taking this opportunity again, I thank you all to be here with us and do your best how we can improve the situation of this hospital. Thank you very much again.
সম্মানিত সুধী, ইম্পেরিয়াল হসপিটাল লিমিটেডের পক্ষ থেকে জনাব এমি মালিক স্যারকে ধন্যবাদ জ্ঞাপন করার জন্য বিনীত অনুরোধ করছি।
নামে আরম্ভ করছি। Today I am entrusted with a very noble job, thanking you all for coming all the way, leaving aside all of your job and holiday, because today is a holiday for some person but not for some all. And for last about 1.5 hours, you are sitting over here with a hot, humid condition and thus giving us the encouragement to go forward in our venture. I can assure you today that in future, when this hospital will be started in January, we will have a fantastic air-conditioned, fully air-conditioned hall here where you can sit around, loiter and go for treatment and everything. Because today we are almost 90% done. At the very outset, I must thank Mr. Christopher, MD VAMED, for coming over here for signing the agreement with Imperial Hospital Limited. And our engineer, Mr. Shepherd, is working with us for last few years, coming all the way from Europe and all other places to help us in building this wonderful hospital which is going to be started for Chittagong people to get the services. And I also thank Mrs. Christie for being here and helping us for interior decorations and others. Actually, I am as a chairman of the CIETC, who is the founder of this hospital. You know the CIETC, the Chittagong Eye Infirmary and Training Center, is a trust, and you know we already run a hospital which is known to all over Southeast Asia for our service, and we have started this service from 1982, and we have, in this period we have given services to the millions of people in and around Chittagong and in Bangladesh and even outside Bangladesh. So we are doing some human service for the needy people of this country, and as you know, this is a trust. We have a provision for 20% of free treatment, and this is also a part, this Imperial Hospital is also a part of this trust. So we have kept a provision of 20% free treatment for all our needy people and poor patients of this country.
Today, actually, where we are sitting, already our chairman, Mr. Rabiul Hussain, and our previous two speaker and our MD has spoken all about the hospital, its future, and what will be here and what we are going to provide for the patients of Chittagong and in and around Chittagong. And the recent task that has been entrusted to me is to give the thanking you all. I must thank all of you, the guests, those who are present here, because for such a long time you have given your time to be with us, to encourage us to go for future completion of this project, which is almost 90% has been done already. And to our journalist friend, I must thank all of you because you have taken the time out of your schedule to be here and to see what we have done in last few years. You know, when I go out, people ask me when the Imperial Hospital is going to be started. We had so much of hurdle. At the beginning, in this trust, after the completion and after the successful running of this eye hospital with Rabiul Hussain and our CITC directors, we were sitting and thinking what we can do for Chittagong in the health center. Then we came out, we had a dream to do it. Today, the dream is almost completed. We are 90% of our dream. And Mr. Rabiul Hussain and I and other persons in the committee, we went to some very benevolent people of Chittagong, but very few of them came forward to be with us. As you know, this CIETC is the owner of 75% of this hospital, and the 25% remaining, it will come from UCBL and the World Bank. But for the UCBL part of thing, I must name Mr. Akhtaruzzaman Babu for his kindness. When we are going door to door for finance, I went to him. He readily agreed to come over here and see what we have done. He came over here and he expressed. He said that, I am taking a bit of long time because this is a history. He said that whenever people come to us and ask for money, I go there and see that this is only a barren field which they have already given some money to acquire it. But today I came over here and see such a huge building and everything. So he said that I am ready because I am from Chittagong and I will see in the next board meeting it should be done. And he has done it. I am really grateful to him. And after his death, his son, Javed, he also took a great interest in our hospital. And I must name again Mr. Muhammad Ali, who fought all the way with all the directors to give us the loan. And today, this is the reality. And when I am telling you, I must name some of our directors who came forward to help. There, Mr. Al-Mahmud, who is the managing director of this hospital now, and Mr. Salim Ahmed here, our director, and Mr. Ariful Karim is here, Mr. Kamal Ahmed is also here, and Mr. Jahangir Chaudhary is not here. And we are really grateful to all these persons for their support and to become a partner with CIETC for this hospital to be in reality. Again, I'd like to thank you all for coming and joining us in this project. Today you have given us so much of goodwill, good luck that we must go forward and give a good service to our local people Because just now our Vice Chancellor saying how much money we are draining out for the foreign countries for our treatment, to go to India, to go to Bangkok or in Singapore. I think with the establishment of this, that flow of the people will come down to Chittagong rather than going outside the country. With this word, I must thank you all, and I must ask you to pray for us so that we can complete the project and go forward for the service of the local people. Thank you very much. Thank you all.
ধন্যবাদ। সম্মানিত অতিথিবৃন্দকে চা চক্রের জন্য আমন্ত্রণ জানানো যাচ্ছে। আপনাদের সবাইকে আবারও ধন্যবাদ।